As you can imagine, I'm very pleased to open today's conference. It is already 18 years since I introduced the workplace smoking ban, and we've come a long way since then, getting ever closer to achieving the theme of today's conference, Tobacco Endgame, No One Left Behind. Through political leadership, the work of our health services, advocacy by non-governmental organisations, and most importantly, through public engagement and support, we have made huge progress in tackling the harms caused by smoking. At the turn of the century, 1 in 3 people smoked. Now it is 1 in 5. Of critical importance, rates of smoking initiation among our children and young people have radically reduced, and our exposure to the dangers of secondhand smoke in indoor spaces is a thing of the past. Laws, campaigns and initiatives at national and local level across the country have enabled progress, but the real momentum for change has been driven by our culture, by change in our collective attitudes. As a result, we have a completely different relationship with smoking to the generations that came before us. This conference provides an opportunity to celebrate and learn from the progress we have made to date, to understand how we made these gains, and to prepare for further bold, ambitious steps in tobacco control. And we need to remain ambitious, because despite our progress, almost 100 lives continue to be lost each week in Ireland due to the harm caused by smoking. That's almost 100 of our family, friends and colleagues who continue to suffer unnecessarily and die because of tobacco use. This needs to stop. I don't need to remind this audience of the goal we set for ourselves as a country in 2013. We committed to delivering a tobacco-free Ireland, a bold ambition, and a commitment we reaffirm today. For the almost 100 people a week who suffer needlessly, and for the family and friends who are left to bear witness to that suffering, we should accept nothing less. It won't be easy. Our most valuable ambitions never are. We need to double down on implementing things that we know work. Denormalising smoking to protect our children, applying tax on tobacco products to full effect, and ensuring we offer effective help for people who still smoke to stop. We also need to identify innovative solutions to tackle smoking. I particularly welcome the discussion today around so-called tobacco endgame tactics and the steps you have taken to involve the views of the public in shaping that discussion. And we need to remain vigilant in protecting the great progress we have made from interference by the tobacco industry. Their voice has no place in our discussions. We have come a long way. Today, you will take the next steps. When you discuss how to deliver a tobacco-free Ireland for our next generations, I want to underline the importance of the theme, leaving no one behind. As smoking rates decline, the variation in smoking across population groups becomes clearer, and there's a real risk that our poorest and most excluded groups could be left behind. The burden of smoking-related harm is already borne heaviest by these groups. This is unfair, unjust, and unacceptable. Everybody should share in the benefits from the progress we have made in tackling smoking. Ensuring no one is left behind must be central to our goal of a tobacco-free Ireland. Your discussions today will save lives. You have my full support and that of my colleagues, and I thank you sincerely for your work.